Lamotrigine is a popular medication that may be prescribed to you if you have episodes of epilepsy or bipolar disorder. It is well familiar with many brand names like Lamictal. It works well to control convulsions. However, you need to know many important facts about this medication before its use. Lamotrigine can cause a rash, but what is the impact of the rash produced? What is the right dose? Whether it should be taken daily or on alternative days? How does it work? What is its effect on alertness? How should it be managed? All such things are highly essential to know. So without any delay, let's explore such key facts in this video. How it works. Epilepsy results in excessive stimulation of a few neurons in your brain. Many chemicals are involved in neuronal stimulation, and their role is very complex. Among them, a mediator called glutamate plays a key role in activating the majority of central neurons. Lamotrigine blocks the action of glutamate in your brain. It blocks receptors for glutamate, which results in reduced neuronal stimulation. This brings a calming effect on neurons and reduces convulsions. Lamotrigine works in a similar way, even in the treatment of bipolar disorder. Due to its inhibitory effect on neurons, it reduces the manic phase, which is actually associated with high neuronal activity. What is the right dosage? The dosage of lamotrigine is variable from individual to individual. It is always better to start at a low dose, such as 25 milligrams. It can be given either once a day or on alternative days based on many factors, like the purpose of its use and what other medications are co-administered. For example, if you are using other anti-epileptic drugs like valproate, then lamotrigine may be given on alternate days initially. Therefore, never use lamotrigine at higher doses or frequencies than prescribed. Next is hypersensitivity. A small number of individuals may experience hypersensitivity due to the use of lamotrigine. Consequently, it can cause skin rashes. Approximately 3 out of 1,000 people may observe these side effects. A particular group of people may be more sensitive to this medication. The risk is more pronounced in children than in adults. Even though they are rare, these allergic reactions are serious and fatal. In the event that you notice any skin rash within the first 4 months of receiving the treatment, it is important to closely monitor for any other significant symptoms. Since it has the potential to impact various organs, such as the liver and kidney, one may observe the subsequent symptoms. If you have any swelling in your throat, face, lips, or neck, it may indicate the development of angioedema. Fever, abdominal pain, dark-colored urine, severe dizziness, yellow skin, and yellow eyes may indicate a serious condition. Normally, you may observe skin rashes within 2 to 8 weeks of treatment with lamotrigine. However, the incidence of skin rash may be enhanced by the use of higher doses on initial days. Sometimes, the rash produced by lamotrigine may be of the Stevens-Johnson syndrome type. It is a life-threatening hypersensitive reaction that causes painful red sores on the mouth, painful skin, and blisters on the skin. If you notice any indications of a skin rash while taking lamotrigine, it is crucial to promptly consult with your doctor. Your doctor will assess whether the rash is associated with lamotrigine or not. If it is not drug-related, there is no need to stop using lamotrigine. If the issue is directly linked to the use of lamotrigine, you might be advised to discontinue this medication or switch to a different one. In these situations, it is best to avoid using lamotrigine, even in the future. Abnormal blood counts. Lamotrigine may reduce your blood counts on long-term therapy. They are commonly known as blood dyscrasias. You may have anemia, which can make you feel tired and weak. Your neutrophil counts may be slightly reduced. This may increase the risk of a few infections. You can also observe a drop in platelet count. However, these blood counts are slowly restored after stopping therapy. What are the common side effects? Lamotrigine can make you dizzy and lightheaded. You may have drowsiness and a loss of balance on the initial days of treatment. Your body will slowly adjust to this medication. Therefore, it is better to take caution with the works that need more attention. The extent of drowsiness may be enhanced by other conditions. A few medications that induce sleepiness and a high intake of alcohol are the predisposing factors for increased drowsiness in people. You may also have a dry mouth, stomach pain, and blurred vision. Effect on contraception. In women taking contraceptive pills, lamotrigine levels in the body may be affected. Especially estrogen-containing contraceptive pills can increase the clearance of lamotrigine from the body. There is no need to increase the dose of lamotrigine initially. However, the maintenance dose can be increased to obtain better therapeutic effects. The extent of dose increments is based on many factors. Your doctor may increase the dose if you start taking estrogen-containing contraceptive pills. Similarly, when you stop taking contraceptive pills, your maintenance dose of Lamotrigine may be reduced. Sudden withdrawal of Lamotrigine. Never stop taking Lamotrigine without consulting your doctor. Sudden withdrawal of this medication can increase the risk of convulsions. If you miss a dose, you can take it any time on the same day. But never combine the missed dose with a regular dose the next day. You can skip any missed dose if it is not possible to take it on the same day. However, if you stop taking Lamotrigine for several days, it can increase the risk of convulsions. If you want to stop taking Lamotrigine, you should slowly reduce the dose over at least 2 weeks. Use in pregnancy. If you become pregnant while taking Lamotrigine, you should be careful with its use. It is not causing any direct harm to the fetus. However, high levels of this medication in your body during pregnancy may affect the kidney function of newborns. They may have less capacity for conjugation in the kidney due to the insufficient establishment of the renal system. Therefore, newborns may have less clearance of drugs, leading to the toxic effects of this medication. Lamotrigine is also secreted into the milk of breastfeeding women. Therefore, you should use this medication during pregnancy whenever the benefits outweigh the risks. Effect of valproate. Lamotrigine can be used for epilepsy in 2 ways. It can be used alone to control seizures, which is often termed monotherapy. It can also be combined with other anti-epileptic drugs, and here it works for adjunctive therapy. Many anti-epileptics are available to be combined with Lamotrigine, such as carbamazepine, phenytoin, and valproate. However, a few drugs like valproate can affect the levels of this medication in the body. Valproate shows a significant effect on serum levels of Lamotrigine. It reduces its excretion by inhibiting its conjugation in the kidney. This increases the levels of Lamotrigine in the blood, which can lead to serious side effects. Therefore, don't take this medication at a regular dose while it is combined with valproate. Your doctor will adjust the dose of Lamotrigine to an appropriate level. In a few people, Lamotrigine can be used for purposes other than epilepsy. For example, it can be used to control mood swings in people with bipolar disorder. In such cases, the dose of Lamotrigine should be reduced if valproate is prescribed to control epilepsy. Abnormal thinking. Just like many anti-epileptic medications, the use of Lamotrigine is also closely linked with the development of self-harm and abnormal thinking. It is especially prevalent in young and adolescent people. Therefore, symptoms like agitation, nervousness, self-harm, or suicidal behavior should be closely monitored. These are the essential facts that you need to know before you use Lamotrigine. With proper precautions, Lamotrigine can be safely used in the treatment of epilepsy and bipolar disorder. That's all, guys. Thanks for watching. Have a great day.